You're listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our Razorcast studios in New York City, where we are dedicated to bringing you cutting-edge interviews from many of the leading industry professionals across the U.S. In today's episode, we are speaking with Dr. Matthew Finney. Dr. Finney is the founder of the Chiropractic Doctors in Grand Rapids, Michigan, where he is committed to improving the health and vitality of his community through chiropractic and wellness care. He is originally from Toronto, Canada, and he graduated from Bishop's University and then from Palmer College of Chiropractic in Davenport, Iowa. Dr. Matthew Finney is widely considered to be one of the top chiropractors specializing in holistic and alternative health in the country, and he is also a contributing member of our national network of industry professionals. Today, we are going to talk about a very important topic, low back pain. Hi, Dr. Finney. How are you today?
Hey, Liz. I'm doing great. How are you?
I'm doing great, thanks. So the first question I have today is, why do so many people experience an achy pain in their lower back? It seems to be a very common problem for young people as well as more mature people.
Yeah, that's a great question, Liz. I appreciate you asking me that. One of the studies I just recently read is they estimate that 8 out of 10 or 80% of people will experience some sort of significant back pain at some point in their lives. One of the things really I attribute a lot of it to is what we do on a daily basis. And what do most of us do is we sit. We sit at a desk every single day in a chair all day long. As far as our kids, we put them at a desk from the age of about 5 when they start kindergarten, or sometimes 4 if they're in preschool. We sit them at a desk, again, same thing, 6, 7, 8 hours a day, all day long. And we expect there's going to be no sort of physical repercussions for that. And so from a purely a biomechanical, structural standpoint, anytime that you're sitting all day long, it forces you to round out your lower back, and you can lose. There's a curve that you're supposed to have in the lower back in order for it to properly support your body. Have you ever sat in front of a desk like in front of a computer and sat up nice and straight for the entire time that you're there?
No.
Most people typically, yeah. What happens is we start to get tired, or we start to think about something else, and we start to slouch. And we shift forward, and it puts a tremendous amount of stress and strain on those sensitive structures, those discs and those joints of the spine. And that's what causes them to get irritated. That's what causes them to get inflamed. And that's what causes them also to become very uncomfortable or painful. One of the things they're talking about now is they're talking about sitting being like the new smoking. And they're saying that sitting is like smoking in the sense that if you smoke cigarettes, no matter what else you do, it's still going to be bad for you. So you can smoke cigarettes and run 10 miles every day and go exercise and eat fresh raw fruits and vegetables, have the healthiest diet in the world. But if you still smoke, there's still a very high probability that you're going to get lung cancer.
Right.
Now, same thing as far as sitting. A lot of people sit and they say, well, I went to the gym this week, or I went and did a stretch this morning. And they think that cancels out that sitting. And what they're finding is that people that are sitting, all of those other things that you're doing that are positive for you, they're not canceling out the negative effects, the deleterious effects that sitting has on the spine. And so I think that's a big, big problem that we have nowadays, is that we're sitting all day long. It's very tough on the body, sedentary living, very tough on the spine. And we're starting to now see the effects of that more and more and more as people are getting older.
Okay, great. And I know people talk about the core and strengthening the core, and that helps, everybody stand up straight. But it's a touchy subject for me. All the core workouts we're all supposed to be doing, and I try and fail. But let's move on to weight gain, which is another, issue for most people. Does weight gain trigger back pain?
Great question. As far as triggering back pain, if we were to just say strictly, if you're heavy, you have gained some weight, then you're going to have back pain. If that were the case, then everybody over a certain, say poundage, if you weigh more than 200 and whatever pounds, then you're going to have back pain. Is that true?
Well,
No.
if you're, no.
So there's people that are 300 pounds that don't have back pain. There's people that are 120 pounds that have agonizing back pain. So to say that weight gain or weight is the only cause of back pain, that's not true. Now, it can definitely be a contributing factor. Again, it's basic physics. The bigger you are, the heavier you are, the more stress and strain that you're going to put on your body, the more likely it is that you could have pain. But it usually takes some sort of underlying issue, underlying problem. And it's typically not just the weight, because if it was just the weight, then everybody that's over a certain, weight on the scale should have that same sort of thing. But we know that's not the case. But it can definitely put a lot more stress and strain on the body, and it can open you up to a lot of the other more serious chronic and crippling conditions as well, things such as heart disease, cancer, diabetes. Those are all associated with weight gain, again, in sedentary living.
Right. Okay. And, this is something that affects a lot of people as well, arthritis. And can arthritis settle in one's back, or would there be something else going on? Some people think I have arthritis in here, I have arthritis there. Can arthritis actually settle in somebody's back?
Yeah, great question. The scary thing is, Liz, it can. If there's things that are going on and they're ignored for a period of, say, months or years, that's when, over time, arthritis can develop. So a lot of times people think of arthritis as this thing that all of a sudden just showed up and you're stuck with it. Arthritis is something that's developed over, years in response to the stress and strain and the way that your body's working. And so you go through, over time, these phases or these stages of what we call degenerative change. And so when you start to lose the structure, when you start to lose proper movement, that would be a phase 1. You go into what we call phase 2 of arthritis. That's when you start to see the discs of the spine or the cartilage of the joints. That's when you start to see that stuff wearing. Phase 3, and this is when, if you want to talk about settling in, this is when you start to see the more permanent damage. This is when spurs start to form, the little jagged edges that you'll see, bone spurs. You've probably heard of somebody having some sort of arthritis in their shoulder, arthritis in their knee. That's typically what they're referring to as far as settling in.
Okay.
And then you get to what we call like a phase 4, and that's when it's there and you cannot correct it anymore. That's when the arthritis is no longer fixable. You have permanent damage, and that's typically when you're talking or consulting with like a pain management specialist, or you're talking to the guy in the white jacket, the scalpel, the surgeon, and they want to go in there and they want to do like a fusion or a spinal fusion. So that's why we always recommend, anytime there's something going on, getting it corrected now, because the longer you wait, the worse it gets. The worse it gets, the less likely it is that you can fix it, the less options that you have. And the more often than not that it's set in and it's permanent and you can no longer fix it.
Okay. And for the average person with low back pain, does heat or ice help? I guess that's always the debate.
Yeah, great question. We, in our office, we always recommend, in the beginning, we'll typically recommend ice. And the reason why, ice is great at reducing or decreasing inflammation in a specific area. Anytime you introduce or you put heat onto something, that increases blood flow, it increases circulation, but it also increases inflammation. And inflammation is what causes pain, right? And so most people, when they have inflammation, when they have pain, they take an anti-inflammatory, correct?
Okay,
and so that's not fixing they're just simply masking. That's not fixing the problem. They're taking these pills, they're taking these medications to mask the symptoms. They feel better temporarily, but still the underlying cause is there. And that's getting back to the arthritis question. That's why things can go on for for months and even years and years and years, and people not necessarily know about it because that pain will sort of come and go. They'll mask it temporarily with medications until it gets to that point where you're at a phase 4 degeneration, and you can no longer fix or correct that problem.
And
so we typically will recommend ice. Sorry, go ahead.
No, I was just going to say that I know you're recommending ice to reduce the inflammation, but you see a lot of people laying on the back with the heating pad. Is that just because it feels better for them, or why would they be doing that?
Heat definitely feels better at the time, for sure it does. Nobody likes to. Nobody likes to.
No, nobody likes to.
You ever got?
No, they don't.
So heat is one of those things that definitely does feel better, and then heat is also good for like those long-standing sort of chronic muscle strain type situations. I'll see that a lot of times with the volleyball players. We take care of a lot of athletes, Olympic level athletes, professional athletes, elite level athletes at all different levels. We're part of a large network of doctors known as the Wellness Champions, and we take care of different types of athletes in different professions all over the country. That's one of the things we'll commonly see with them is like that chronic muscle type strain, and that would be a situation where you want to get blood flow, you want to get circulation, you want to get oxygen, you want to get stuff to that area to help it heal, to help loosen it up, to help get it moving. But more often than not, from a pain standpoint, let's get rid of the inflammation, get you out of pain. The faster we get you out of pain, the faster that your body is able to actually heal and correct, and we can get to the underlying cause of that thing, underlying cause of the problem.
That makes perfect sense. And last question I have is a fun topic, the athletic area. Do athletes naturally have stronger backs than the average person? Kind of a easy question, but I think the underlying question is maybe if they do, why? And let's talk about sort of the makeup of a really athletic person and what goes on with their back versus the average person.
Yeah. Okay. Great question. Obviously the strength of your back, the condition of your back, the condition of your body is dependent on what you're doing on a daily basis. That's not rocket science. If you sit on a couch or you sit at a desk or you lay in bed all day long, your body is going to adapt to that. And really, it's not going to do a whole heck of a lot physically. Now, if you're an athlete, you're a high-level athlete, you're a professional athlete, really your job requires your body to function properly. And so they're up, if you've seen the schedule of a lot of these professional athletes, is they're up doing things from first in the morning to the sun going down, things that will benefit their body. And so professional athletes, they have to maintain that level of performance, usually for a period of probably 3 to 5 years. That's the typical career span of a professional athlete. Now, the average person, which we're comparing that to, we would call those like occupational athletes, people like you and me, our pay scale is a little bit different, Liz. We don't get paid quite the same as the professional athletes do, and we got to work a lot longer. So we got to maintain ourselves, we got to maintain our level of performance for the next 30 to 50 years. But we're not doing the same things that they're doing, that those professional athletes are doing on a daily basis. Because a lot of times, we're at work. We're either sitting at a desk or we're doing it, whatever it is that we do, but we're not up in the morning, we're not on the bike, we're not in the pool, we're not doing the hydro, we're not doing the things that they're doing. But in our office, we teach a lot of those behaviors, the things that the professional athletes are doing, and we apply them to people like yourself and I and those people that are listening, to the corporate athletes, to the occupational athletes, the people that want to perform at an elite level for the next 30 to 50 years so that they can continue to work, continue to earn an income, and continue to enjoy the lives that they create for themselves. So it doesn't become time to retire and they end up, having to get a hip replacement or a knee replacement or a back surgery so that they can enjoy their families, they can enjoy their grandchildren, they can really live the life that they want to live.
Okay. So I think that's it for the specific questions I had. It sounds like there's so many facets to, talking about low back pain, but you've touched on some really, really interesting, aspects of it. So thank you so much for being here with us.
Yeah, thanks for having me.
Yeah, right. And for our listeners across the country, if you are interested in speaking with Dr. Matthew Finney, you can either go online to www.thechirodocs.com or call 616-432-3103 to schedule an appointment. And on behalf of our entire team at RazorCast, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.